everyone. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our common skin issue that affects people, many people actually. So, dry skin is a problem which we and our near and dear ones would have encountered at some time in their lives. Dry skin occurs when the skin loses its natural oils and moisture, leading to a rough and tight and sometimes itchy feeling. While occasional dryness may be a temporary issue, chronic dry skin can cause discomfort and impact on overall skin health. According to a study conducted by the Indian Journal of Dermatology, nearly 30 to 40% of the Indian population experiences some degree of dry skin. This prevalence is relatively higher in regions with low humidity levels, such as northern and western India, where the dry weather conditions are more common. So, in today's digital world, it's a boon or blessing that we can get to hear from an expert dermatologist online about dry skin concept and how we can prevent it, the kind of tests which are required for its diagnosis, the right treatment and management approach for an early age. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Malar Nisha R. Dr. Malar Nisha R is MBBS, MD, DVL, and is a distinguished dermatologist based in Chennai, bringing over 8 years of extensive experience in skincare and treatment. Specializing in dermatology, Dr. Nisha is well regarded for her expertise in managing acne and providing effective solutions for acne pimple treatment. Her approach to dermatology is deeply patient centered, focusing on individualized care that caters to the specific needs of each patient. Dr. Nisha excels in treating various skin conditions, including acne scars, and is committed to implementing innovative therapies for challenging issue like actinomycosis and acute burn care. She is currently working at Apollo Hospital, Chennai. So, over to you, ma'am. Let's move on with the first question. We are talking about dry skin today. Tell us, is this a condition or does it normally happens because somebody's not taking care of your skin or say not applying moisturizers as our dermatologist normally suggests us?
So yeah, as you said, like it's a condition that causes mainly due to the application, like we are not applying any moisturizer or you're not taking care of the skin properly, so which lead to the skin barrier loss. So there is a barrier called skin barrier which basically protects the skin as a brick wall, and it retains the moisture to our skin. So due to some certain conditions, like when even during the climatic changes, when it's very hot or even when it's very cold, there are some chances of your skin barrier getting damaged, and other factors mainly like aging or stress or whatever the other certain other genetic conditions are also there which causes this dry skin. So when your skin barrier get damaged, so it leads to cracks and gaps in your skin, which is we always say it as dry skin or dehydrated skin. So this lead to kind of itching, and your skin become more sensitive, and you get all these kind of flakiness, cracks, and everything. So basically, we need to maintain a good skincare routine actually to prevent all these kind of dry skin.
Right. Apart from this, doctor, what can be the most common cause of dry skin?
So, as I told you, the most common causes is like when you are not taking care of the skin properly. The second one is due to
Mm-hmm.
aging, like due to a skin aging and even due to sun exposure. So, it causes sun damage, and of course, it damages your skin barrier and it leads to dryness. And even stress, nowadays, even stress can cause skin dehydration and dry skin. So, mainly
Right.
these
But
factors are which are commonly affecting. Yeah,
right.
tell me.
Doctor, we are particularly focusing on taking care of your skin. Skincare has nowadays we see almost every second person taking care of your skin. I mean, the awareness which dermatologists are trying to spread amongst our society is somehow working because we get to see effective results when we are taking care of of our skin. But There is also a part of the society, there are few people who, no matter how much ever they take care of their skin, uh, it somehow does not work for them. I have seen so many people, they suffer drastically because of dry skin, flaky skin, or can we say, can this be genetically transmitted? Is it possible?
Genetically, yes, of course, but not to the same extent. Even if the mother is having a kind of dry skin genetically, that it's not the same thing. The children is not going to get the same. Maybe one of two of the kid out of two, one kid will be affected, but not to the extreme. Maybe at least 30% or 50%. Like we tend to see usually people having kind of dry skin mainly over their legs, like which we
Right,
call it
right,
in normal term as fish skin, we say. So that cause seems to
right.
be like cracks and dryness in the skin, but it's not like
Mm-hmm.
100% genetic. The add-on factors, as I told you, that also will lead to the dry skin.
Right. So, doctor, what about them? How do they take care of their skin? Because the normal moisturizers and the normal creams don't tend to work for them quite well. So, what kind of care should they take for their skin specifically?
So, as you said, like it's kind of actually it is kind of hard only to maintain the normal moisture to that kind of dry skin. Only thing is we need
Mm-hmm.
to prevent and we need to protect the extreme dryness condition. So we have to use moisturizer which contains ingredients like more of ceramides and other ingredients mainly like which is like more like a cream or an ointment. It's better to go like that for extreme dry skin conditions. And the ingredients should be like ceramide, and there are many other ingredients like jojoba oil, and even at home-based remedies, you can apply a lot of coconut oil also. That also will help it. And main
Right,
thing is we have to prevent from harsh skincare ingredients. So that's what you have to do, and you
right.
have to add on what to say, like some antioxidant foods. We say, no, like some add on like fruits, like pomegranate, vitamin C's, and
Mm,
carrot, and other things like food items, mainly beetroot, carrot, and other things. And if you're a non-veg, it's better to add like omega-3 fatty acids through the salmon fish, and even the other fatty fish that contains these kind of good protective ingredients for the extreme dry skin.
right. Doctor, let's start from the beginning. You
Yeah.
have mentioned about home remedies. We being from the Indian society, our skin acts like a experimental palette for us. We like experimenting, doing
Mhm.
whatsoever. We apply food items in our skin, we grind them, we make a paste, and we do whatnot with our skin. But are these home remedies safe? Should we actually keep on doing it? Because we from childhood onwards we have learned that आप बेसन लगाओ skin में if you are trying to remove the tanning, apply tomatoes, it can help remove tanning, clearing marks from the skin. Papaya is another thing which we eat and we
Yeah.
also apply on our skin. Potatoes for dark circles, cucumber for dark circles. So are these home remedies actually working, or is it all a myth?
So whatever the home remedies you told me, it will actually work. Like the potato juice you are saying, no, that will reduce, of course, the tanning. And even there are like if you add some honey to your face with curd, it will reduce your tanning. So all these are safe unless you don't apply too much. So if you apply lot of some people know they tend to add on lemon juice or lemon to the skin. I mean lemon to the home remedies,
Mm-hmm.
home care product, and they just apply on the skin, which actually it's not safe for everyone, because for one person it will be easy, for one person it will not be easy. So it's always better like not to go and trust for the home remedies 100%. Sometimes some home remedy, like you said, like papaya or the cucumber that or aloe vera. So some for some person the aloe vera will be allergic. For some person the aloe vera will be very good. So it's actually better not to I mean like do any home remedies and just trust on the home remedy whatever it's given on the any social media channel or anything, because it's not going to work the same for everyone. So it's always better to
Right.
do some kind of patch test or anything and then check, because
Mm-hmm.
all these home remedies, when it's not working properly, like it causing allergy to your skin, no, so that will lead to some kind of acne or burns or anything like. So it's
Right.
always
Uh,
better not to trust on home remedies.
right. Right. No, well, we always say that visit your nearest dermatologist. Maybe your dermatologist can suggest you some home remedies
Yeah, yeah, of
which you are
course.
willing to, uh, uh,
Yeah, of course. But depending on
apply
the
or
skin type.
of course, of course. As we always say that following somebody else's life in a good way can be helpful, but somehow everything won't be same. Maybe some dermatologist has suggested the person whom you are following, so they are under some guidance, and you also need to be under some guidance. So our experts are always there to help you out with the best possible solution. Doctor, you also mentioned diet. We know that when it's about a skin, it reflects whatever is inside the body. Basically, हम जैसा खाते हैं वैसा हम दिखते हैं. We have heard people saying this, and somehow we believe it's true. Uh, Now, speaking about the diet, which you have already mentioned, we get a lot of supplements in the market nowadays. We see people skipping their food and they get food alternatives in the market. Also, the fish oil, the salmon fish, which you have
Yeah.
mentioned, we also get fish oil supplements in the market. So, can these supplements be taken? Do we suggest the people, or the direct source of food is what one should go for?
Actually, it depends on, see, skincare supplements, not all the supplements will do the enough for your skin. So you have to take on the food also. But there are some skincare supplements like skin gummies, no, for glowing skin. They give lot of gummies.
Mhm.
But to be frank, all the gummies contain only a lot of sugary added products compared to these actual actives to be present. So it's actually better not to trust fully upon the skincare supplements. It's better to take it orally also. So it always depends on what a doctor or a dermatologist is going to give. It's not to purchase everything whatever is seen on any kind of purchasing app. So not to trust.
Right.
It's better not to trust on all the products. Even the fish oil you said, no, like it's available as gummies also, right? So some are good, some are not 100% pure. So it's
Right.
better not to
Right.
trust.
So absolutely. So always opt for the natural source. That is the safest and the best. As we are looking for no side effects, we always tend to look for things which does not have side effects nowadays. Even medicines, though all the medicines, they do have some percentage of side effect. That is the reason we are asked to take it or consume it under an expert advice, because they know how much medications do we need for our health. Coming back to the point again, doctor, last day I was just watching a video where a person was saying that sugar is the worst poison anybody is consuming because it's addictive, and it is the worst thing we are doing to our health. But tell us, does sugar has any adverse effect on our skin as well?
Yeah, so basically, for a diabetic person, whoever is having diabetes, tend to get lot of skin problems, mainly a dry skin, and they have lot of itchiness. We call it as xerosis, like kind of extreme dryness. They get itching all over the body. So when their diabetes is not under control, they tend to get more. And they lead to kind of
Hmm.
skin rashes, and we call it as eczema. So it turns to be an eczema. So the eczema is nothing but just a dry skin with extreme condition leading to skin rashes with cracks and other might lead to kind of ulcer also. So all these
Hmm.
are the main skin issues which a diabetes patient is going to get. So as you asked me, so the insulin level has to be maintained. So whenever we take lot of sugary amounts, no, that causes even acne or kind of for a dry skin, I'm saying about eczema. The other skin conditions could be acne, or even, of
Mm-hmm.
course, you get uneven skin tone, and your skin barrier is getting damaged. Because of that, you get loss of hair also, like hair fall problem also happens due to the when you're taking lot of sugary amounts. So always
Okay.
control your sugar levels. It's always better.
Right. Right, right. But we also know a lot of people who have stopped taking sugar at today's date because people are aware of the harmful effect of sugar.
Yeah.
We have a lot of sugar alternatives. Coconut sugar is one of it, which
Mhm.
is widely been taken nowadays. We get natural sugar sources. People
Even
have
palm
started
sugar.
consuming those. Even palm sugar, yes.
Yeah.
Even getting sugar from fruits, say dates. I know a lot of people in my life who has quit sugar.
Mhm.
So can quitting sugar completely have any adverse effect? Again, as you have already mentioned, that excessive doing of anything would not be nice. So what about sugar? If we completely quit sugar, will our health be at a risk?
Okay, I will not ask to completely quit the sugar. It's better to quit the white sugars. Okay, you can go for the
Right.
kind of brown sugar or palm sugar or coconut sugar. It's not about
Mm-hmm.
completely quitting the sugar, because it's highly impossible for completely quitting the sugar. Because if you are going to have any kind of fruit juices or anything like any other food that contains at least a little sugar amount, it's
Right.
only thing like we have to just avoid excessive amount of sugar.
Right, right. Moving ahead, doctor, what about hydration? Tell us the role of hydration when we are talking about dry skin. How important is it to keep our skin hydrated?
Okay, so hydration is very important to prevent first dry skin. So, and dry, dehydrated skin, you have to prevent it only through the amount of hydration you give it to your skin, both externally and internally. So, externally, you have to apply a good moisturizer which contains certain good skincare ingredients. Mainly, it's better to go for a cream or any kind of ointment. Better to go for a creamy form than a lotion form, so that it acts as a very good skincare to the our dry skin. Okay, and internally, if you ask me, it's better to drink a lot of water. Water content has to be there in your body to prevent extreme dryness and rehydration. So it's better to drink lot of water content into the body by drinking water, or by even by taking lot of water content fruits. Mainly, of course, all the
Mm-hmm.
fruits contains enough water content, and vegetables like you can take any kind of pumpkin or cucumber, or some other water content foods, like you can take go for carrot also, beetroot, and you can take lentils. Lentils are very good for your skin. So all these will
Mm-hmm.
increase your water content in your skin, and that gives you hydration internally also.
Right. Doctor, as I belong from a very humid region, so we face summers here, like we face around 47 degrees here. This year we faced around 47 degrees here. So, what people here normally does is they have a habit of bathing very frequently because of the humidity. And I also see a lot of people wetting their clothes and then wearing it and then going outside because it's almost impossible to walk under the sun in such a humid area. Uh, Tell us, can bathing frequently somehow take away the moisture of our skin? If so, what should one do if he or she has to bathe frequently? Also, another thing is it becomes almost impossible to apply moisturizers during summers. So it is a challenge. We also have to bathe frequently. We also have to apply moisturizers because all the moistures are being carried away by the water. So what can be the solution to it?
So bathing frequently, I will not suggest. Maybe twice in a day. You can bath twice in a day. So that I can suggest. And that too, when you are going for a shower, it should be like less than 5 to 10 minutes, not more than that.
Hmm.
And it's better
Hmm.
now to avoid hot showers. You can go for any kind of lukewarm shower or cold shower is also fine. And after showering, immediately it's better to apply moisturizer. But since you said me during summer conditions, if we are not able to, I mean, like many people doesn't apply moisturizer, but I
Right.
will suggest to
Right.
apply moisturizer. So
Hmm. Hmm. Hmm.
immediately after bathing in on a little damp skin, if you apply a moisturizer, it will actually work and when in summer humid climate, it's better you can go for any kind of external factors like rather than wetting the cloth and wearing it, it's better to go for a loose fitting cloth that actually give a kind of breathable to your skin. And you can you start using a humidifier, so that also will reduce the, I mean, climatic temperature control and it reduces the humidity, right? So it's better to go for that also.
Right. Right. Doctor, because you
So
mentioned
bathing,
humidifier. Uh, yes.
yeah.
Yes, please, please. Please.
So bathing twice a day is fine. Go for just 5 to 10 minutes of bathing and use a good, gentle, fragrance-free skincare, mainly as a body wash or a soap. Don't go for any kind of
Right.
harsh thing which contains more amount of alcohol. That will also lead to dry
Hmm.
skin. Yeah.
Right. Again, coming back to humidifier, doctor, you mentioned it. ACs are widely used throughout the world at today's time. We see people almost unable to exist, survive because without the AC, which is also the reason why the humidity has hiked. We are somehow, we ourselves are responsible behind it. Can frequent use of air conditioners also lead to dry skin, doctor?
And it's better to reapply. It's always better to apply. It's better to apply a moisturizer in an AC room, and its only thing is you have to prevent from dryness. But AC will cause the cold. AC will cause definitely dry skin. Only thing is to prevent
Right.
is by applying the moisturizer again and again.
Right. Again, for the people who are very much frequently using air conditioners, make sure that you are taking care of your skin along with that as well. Whenever you are under the AC, make sure you are continuously applying your moisturizers, your hand creams, your lotions, keeping your lips um, not
Lip
dry.
balm.
So, few things, yes, few things we need to keep in mind, especially for the office goers who does not have any other option rather than sitting under the AC, or for the people who are at home frequently using it. Make sure you're taking care of your skin. Moving ahead, doctor, the next question is: are there any over-the-counter products that can help with dry skin?
Yeah, there are some over-the-counter products. We have to just see the ingredient present in that. Like I told
Hmm.
you, like you can search for a good amount of alcohol-free products, and it should be mentioned as fragrance-free, not unscented. Okay, because when you go for a moisturizer, sometimes it will be written fragrance-free, sometimes it will be written unscented. So fragrance-free is much better because unscented, it means like there are some chemicals in it and fragrance products in it where an unscented is just used to overdo the I mean like it just prevents the fragrance, but it's just a chemical add on to prevent the fragrance, so it's better not to go for any kind of unscented products. And ingredients which we have to look upon is mainly with there are some products like mainly ceramides. Ceramides is basically very good for your skin. It just prevents the water loss and retains moisture to your skin. And other products mainly like dimethicone and some contains jojoba oil, and there are some kind of many other moisturizer also. It's better to see that and you can get it as OTC.
Right. Uh, Doctor, speaking about OTCs, can these OTCs somehow affect our skin as well, if not taken under an expert
Yeah.
guidance?
Yeah, that's what I told you, no? So if you go for any kind of unscented products or if you go for alcohol-based products, and some products may contain retinol. Retinol is what everyone uses nowadays for like
Right.
as an OTC. So all these, it's better to prevent for in case of a dry and a sensitive skin, it's better to prevent these kind of products. But if you ask me, I will always suggest to go to a dermatologist and then get an advice and then follow the cream or lotion, whatever you can. It's good for your skin because your skin type is also only a dermatologist can say your skin type. So because sometimes your skin may be more oily, more dry, little dry, maybe combination, maybe sensitive. So it's better to go to a dermatologist rather than purchasing an OTC product by your own.
Right. Speaking of that, doctor, there are a lot of products. The market is flooded with products
Yeah.
nowadays. So people, they have a tendency of getting whatever they see online. There are products where they send a questionnaire where you have to tick the questions, and then they will actually figure out what kind of skin you have. So let's not name any brands here, but there are such products where the customer has been given a questionnaire, and then he or she answers it, and then according to the skin type the products are being sent to the customers. So are these companies safe? Are they doing some justice to it? Can these be safe for the patients as well?
Not all. I will say like some maybe one or two products will be helpful, but not all. Not all is going to be helpful for everyone. As I told you, no, like for one person, one product will be helpful, but it's not going to do the same help for the other person because the skin type differs, right? So it's not going to be the same for all the skin. So it's always, I will not suggest to go for any kind of OTC products other than a dermatologist suggest you. It's always better to
Right.
see a dermatologist and get your treatment taken. Yeah.
Right, right. So, as we always say, that precaution is better than cure. Make sure you are visiting the expert who has spent this several years of studying about the condition, several years of experience, and then he or she is sitting in front of you giving you a suggestion. Make sure you visit the expert rather than self medicating. Self medication is the worst thing you are doing to yourself. Moving ahead, doctor. The next question is it safe to use moisturizers during pregnancy or breastfeeding?
Yeah, of course, it is safe to use moisturizer during pregnancy or breastfeeding unless it contains any harmful chemicals. So it's better, like I'm telling again and again, just to avoid too much of alcohol or unscented products. Just use a gentle, moisturizing, fragrance-free product. That's actually better.
Right,
You can use it during your pregnancy and during breastfeeding also.
right. Doctor, the main challenge with dry skin, everybody facing dry skin, is during the winters. So, how can one take care of their skin during the winters where everybody is facing the issue of a dry skin?
Okay, so there are some a few tips you can just do it to suit your skin and just prevent dryness during winter. First is the showering method I told you. Like don't shower too much in hot water. Maybe you can go for a lukewarm water shower and you can shower only for 5 to 10 minutes. And immediately after showering, it's better to apply the moisturizer on a damp skin so that it will absorb more and your moisturizer will be on your skin for a long time. So, and while taking shower, it's better to go for a gentle fragrance free soap or any kind of body wash. And after that, the amount of food we take, the internal amount of food, that's also going to play an important role. So it's better to go for a good amount of fruits and kind of vegetables. And if you ask me in non-veg, I'll ask you to go for kind of fatty fish. More fatty fish that's actually good, which contains enough amount of omega-3 fatty acids. If you want to go for any other kind of antioxidant supplements, it's better to go see a dermatologist. And even while you wash your hands frequently, like after COVID, people tend to wash their hands frequently. That causes even dryness to your hands. So it's always better to keep your hand clean. After even the hand wash you're going to use, it's better to go and I mean, like you have to just see whatever it is
Hmm.
harsh and whatever it is gentle for your skin, then you go for a gentle hand wash. And protecting your lip is also very important. So use a good amount of moisturizing lip balm. And of course, after applying a moisturizer, it's better to go for a your makeup products. So, because that is going to prevent from your, of course, any kind
Right.
of acne or dry skin condition. So these are some main few tips which you can do it. And of course, sunscreen is very important. So
Hmm.
sunscreen, because of sun damage, you will get more dryness. So of course, in winter, if you're not having enough amount of sun also, it's better to go for a sunscreen. So don't miss out the sunscreen.
Right. Specifically mentioning about sunscreen once again, uh, make sure the sunscreen is an active part of your skincare regime. You might skip some ceramides, or you might skip the retinol which you are using, but make sure you're not skipping your sunscreen, because it has been widely suggested by our dermatologists that sunscreen needs to be an active part of your skincare regime wherever you are. Maybe you're at home, maybe you're traveling, maybe you're outside. Make sure you are using a sunscreen, doctor. But how do we choose the perfect sunscreen for us? This becomes a huge challenge for everybody who are watching us right now. So which sunscreen to choose, how much to use, and how many times to use?
Okay, so sunscreen to choose is mainly depending on your skin type. So if you have a kind of combination skin or an oily skin, it's better to go for a gel type of sunscreen with enough amount of SPF. SPF is just a sun protection factor. So SPF, if it's very hot and if it's a very during summer, it's better to go for an SPF of 50 plus, or as during winter, you can go for an SPF of 30 plus. And if you have an extreme dry skin, it's better to go for a sunscreen cream or a lotion form. So lotion form I usually recommend to use for your body, and cream form it's better to go for your face. And how much
Hmm.
amount of sunscreen to apply is mainly depending on your face and neck. It's better to apply about the two finger size. That's actually fine, but I don't see anyone applying amount of this much amount of sunscreen. So as far as you need, because you are going to anyway, it's not you are not going to apply the sunscreen only once, because you are going to reapply it again and again. So how much ever
Hmm.
you need, you can just apply, because too much application will make your skin greasy. Some people will feel it heavy. So as much as you want, when you start applying your sunscreen, you will come to a conclusion of how much to apply. So if you are applying morning to some amount of some extent of sunscreen to your face and neck, it's after 2 hours or after 3 hours, it's better to apply enough amount of sunscreen. So reapplication of sunscreen will manage the amount of application. So it's better. Its main thing is you have to apply your sunscreen, and reapplication is very important. And not only to your face, you have to apply to your neck also, and even to your
Hmm.
sun exposed areas, wherever it is, your hands and legs. It's better to go for application of sunscreen. Even when you are inside, like even when you are in the AC room, it's better to apply sunscreen. And because of the amount of light, the blue light which we emit from the LEDs and from the computer, that is also going to harm your skin. And that is the one which is going to give you extreme dryness. So it's better to apply sunscreen in enough amount, and reapplication is very important.
Right. Well, that was all about sunscreen you needed to know. Now, moving ahead with the next question, doctor. What is the difference between dry skin and Alzheimer?
Eczema. Okay. Eczema, you are asking me?
Eczema, right?
Yeah. So dry skin is just a starting stage where you tend to see only a dryness, like a patch, dry patch with cracks, not much of cracks, it's just a flaky skin. But eczema is a condition which is an extreme dryness leading to more amount of cracks, and there is gaps you see in your skin which causes some amount of like watery content coming out. Sometimes it may lead to bleeding also. So you tend to scratch a lot, and it's more amount of dry skin, that is kind of more flaky patches which is going to fall out. So that is eczema.
Right.
So eczema comes
And
only if you are not applying properly.
right. Yes, I did not get you,
Yes.
doctor. So it comes
So it
when we
actually eczema comes when you're not treating your dry skin properly. So you see a dry patch, you are just leaving it just like that. So for a long time, you tend to get this kind of itching. When you're itching or scratching too much, this lead to a kind of condition called eczema. So when you leave the eczema condition also just like that, it lead to a condition known as psoriasis.
right, right. So, doctor, any other health issues which can be caused by dry skin?
Yeah, so I mentioned you before, diabetes is a condition which causes dry skin, and
Hmm.
some other hormonal imbalances that may also lead to dry skin. In women like postmenopausal, they get tend to get a because of hormonal imbalance, they tend to get dry skin. And thyroid disorder, if you have a thyroid disorder which is like uncontrolled thyroidism, hyperthyroidism, you tend to get a dry skin. So, and genetic. So these are some conditions where you tend to get dry skin even if you are taking care of it properly.
But can dry skin lead to any other health conditions?
Dry skin leading to health condition mainly like see, if you ask me like that, I will not say like it will not go. It's not only the dry skin who's going to leading to any kind of health condition. Maybe an associated factor,
Hmm.
like even if you have any kind of renal disease or any kind of liver problem, that may lead to other conditions like renal disease or liver problem. But I'll not say like just dry skin will lead to this condition.
Right. Moving ahead, doctor, I can see some questions coming up from the viewers. I think the first question has been already answered by doctor. The question was, can I use a humidifier to help with my dry skin? Of course, doctor has already mentioned that you can. The next question comes from Pooja Vishwakarma, who asks, can allergies contribute to dry skin?
Yes, of course. So, dry skin mainly seen in the hands. So, that comes because of the allergy to the laundry detergent or the dishwasher detergent which we are using. Because that chemical that is going to cause as an allergy for your dry skin condition to your hands. And same thing for the lip also. Some people will get lip dryness mainly because of the amount of lipstick they use. So it's always better to go use a lip moisturizer or a lip balm, and on the top of that, it's better to apply a lipstick.
Right.
And
Uh, uh, yes, please. Please, doctor.
and makeup products also. That's why I told it's better
Hmm.
to apply a moisturizer and then apply any kind of makeup products, which is going to prevent from the allergies.
Right, absolutely. Whenever we apply makeup, we have always learned this, that make sure you're doing your skincare first and then you're applying your makeup. No matter what kind of skincare regime you follow, it may be a two-step, a three-step, or four-step, or whatever skincare regime you are following. Make sure you're following your entire regime and then you apply the makeup. That will also make your makeup long-lasting and it will also make your face glow. Moving ahead, doctor, the next question which comes is from Firoz Khan, who asks, can stress cause dry skin?
Yes, stress can cause dry skin, but the actual mechanism is not 100% known. But there are
Hmm.
cases where we see a lot of stress because of sleeplessness, not sleeping properly, that also causes dry skin. So, stress, of course, it's related.
Right. Uh, the next question comes from Purvi Mehra, who asks, can dry skin cause wrinkles?
Not to 100% extent, but dry skin lead to many other skin conditions where we tend to get skin aging also. As I told you, because of sun exposure, You get skin aging. Skin aging causes dry skin, and of course, skin aging causes wrinkles also. But these wrinkles, whatever we get due to skin aging is different, and wrinkles, whatever tend to get due to dry skin is different. Because wrinkle, what we say is just like shrinking of the skin. This shrinking of the skin is mainly because of the loss of water content in your body. So that loss of water content comes because of the skin barrier damage, and that is which is causing dry skin. So of course that in that way wrinkles can be I mean like it can come because of dry skin.
Right. Well, that was the last question from our viewers today. The Before we take a leave, Doctor, after this very informative session, any take-home message for our viewers who has watched us so far?
Okay. So if prevention is better than cure. So it's mainly better to prevent dry skin. So whenever it's not about thinking of how to treat a dry skin, it's better to know how to prevent it. So prevention is always better. So prevention should be mainly by following a good skincare regime.
Hmm.
I'm just talking only for a skincare basic dryness, not for any kind of genetic dryness or anything. I'm just telling in common terms, mainly for a basic dryness, which is coming only if you are not going through a good skincare routine. So it's better to go for a good skincare routine, follow with a good moisturizer, apply enough amount of sunscreen, use always a good gentle fragrance free body wash or anything. It's always better to go for that, and intake of food, that is more important. So dieting
Hmm.
means just taking a good amount of intake of food, not skipping the meals. So it's always better to go for it.
Right. Well, that was the expert advice for today, and that was Dr. Malar Nisha R for us. Thank you so much, Doctor, for your valuable time. It
Yeah.
has been quite an informative session for our viewers today, and we look forward to many more such sessions in coming time. Also, thank
Yeah.
you, viewers, for your excellent participation. For more information and updates on skin health and care, stay connected on our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.